Our grief journey continues. I am going through how do we actually grieve. So I went through a personal 45 days every day going through a grieving process. And now in this continued grief process, I am spending time weekly going through what I call controlled grief. And also in this series, I'm sharing what I learned in how do we actually grieve, especially with intense loss. I'm Christy Bundu-Kamara, psychiatric nurse practitioner with over 20 years of clinical experience, but my real experience in this area is from loss. I have lost 3 children over the course of 17 years, the most recent just over a year ago. And if you're following me, you know that in the last video I talked about, I started my 45 days of grief. I went in with kind of what I expected of controlled grief process, lots of crying, remembering, and then I hit this wall of anger. And then after the anger, I went into what I'm going to call a meltdown. And we often use meltdown as a very negative thing, but I want to define it here for a moment. When I say meltdown, it's when your emotions, the feelings that you're feeling, are bigger, stronger, more intense than the coping skills in which you have, or not being able to utilize those coping skills. I have tons of coping skills and lots of experience using them, and I still have meltdowns, right? It's periods of time where there's an inability to self-regulate. And so what do you do with that? Number one, you don't beat yourself up over it. You acknowledge it, that I'm in a period of this inability to self-regulate. Now, I can tell you when I went into this 45 days of grief, my intention was not to say that the mentally strong method is the answer to your grief process. But I hit this point of a meltdown for myself, right? I'm doing this daily grief every day. I'm on day 8. Day 7 was this intense anger. Day 8 was like meltdown. I could not self-regulate. And I was reminded that I do have the skills, that I do have the mentally strong method. And what would people do if they didn't have that? Everything would just get enmeshed. So to let you know, the mentally strong method is a cognitive behavioral approach that I created taking care of myself. It started in 2005 when my adopted son, Johnny, drowned on a family vacation. And the shock of that hit me. And then as we came home, his biological sisters began to show symptoms of PTSD and reactive attachment. My biological son, Reggie, began having seizures and, multiple doctor's appointments. I was working full-time, raising 6 kids, and I had to learn how to self-regulate. And I'm a psychiatric nurse practitioner. I should know these things. I'm a proponent of cognitive behavioral therapy. But there were pieces missing to my education in practical application. And so that's when I started doing what I now call the mentally strong method, where I would take this thought map and I would basically be bubbles. I would be getting all of my emotions out on paper in like 20 minutes and then trying to make choices in line with what I wanted. But there's, again, was a missing step. Those thoughts need to be organized. And this, I think, what often happens, especially in intense grief or trauma, like what your thoughts are. If I gave you a thought map, you could fill that thing up with all of the feelings and anger and emotions and pain and injustice and negative thoughts. It would easily pour out on that paper. But what happens often when we're trying to help ourselves, or even when we're seeking professional counseling, is that we're getting all of those things out, but we're not organizing them so that we can make choices in line with what we want. When Reggie passed away and I was able to lean on the Mentally Strong method by really putting grief in its own category, right? And keeping, if you know the method, you know what I'm talking about, but look at some of my other free content. You know, there's these 10 categories that we identify, and, you know, triggers, grief, trauma, negative self-talk, injustice. Injustice is probably huge if you've lost a child. I know people who have lost a child in accidents, in motor vehicle accidents, or drunk driving where there's actually someone to blame, murder. Like, that is an injustice. And when it gets enmeshed with your grief, you can't peel it apart and have it make sense. And so after Reggie passed, I was able to lean on what I had developed, this Mentally Strong method. And I was able to put the controlled grief in its own category and really take the time to do this controlled grief. And almost kind of proud of myself. I developed a business. I'm sharing the Mentally Strong method with people in classes and in a clinic. But I have to be completely honest. When Maya died in her sleep, it almost broke me, and it still could. And when I was going through this 45 days of grief, I went into the 45 days of grief very specifically because I knew I wasn't really grieving Maya's loss yet. The 45 days ended on the 1-year anniversary of her death. And I knew I wasn't grieving. I was proud of how I had grieved with Reggie, and I knew I wasn't grieving Maya's death. And so I went in this process almost like, I'm not even going to mention the Mentally Strong method because it's not helping. I know it well. I do it on myself all the time, and it's not helping. And I got to my first meltdown, and I realized that what if I didn't have this ability, this formula, this knowledge of cognitive behavioral therapy to be able to pick up the pieces, to put them in its categories. And so I have to share that it's not just thinking through the problems. We have to organize them and put them in categories, because grief, as we feel the pain of grief, the goal is to cherish that relationship. But when you have negative self-talk and anger in choices, and you're making choices that are hurting yourself, or you're beating yourself up with negative self-talk, or you're so angry at the injustices that you're not actually cherishing the relationship, I need to be able to teach you how to separate that. And so it came to the realization for me that day that the Mentally Strong method is part of the solution. Nothing is everything, right? Like, this is your journey. This is my journey. It is a very difficult and painful one. But when I talk about the 5 selves, self-care, self-regulation, I don't know what I would do in self-regulation if I didn't have the Mentally Strong method. Like, I wouldn't be able to put it into perspective. Grief is hard. But the reality is what breaks us is all of the other things that come with it. the negative self-talk, the anxiety of what's next, those protective layers that I talked about in the last video. Like there's all these other components that just, and that's why oftentimes the further the death gets away, the more impacted we are, the more it's impacting our life, the more the pain feels. When it really should be, if we are actually embracing this process of controlled grief and taking the time to feel that pain and separating it from the other factors, the triggers. Triggers is its own category. And literally right before this series of videos, I found out that an acquaintance died in his sleep. And although I feel horrible for the family and people that worked with him and knew him well, the reaction I'm having is a trigger to my own daughter dying in her sleep. But that's its own category. Things like that are going to happen. Things are going to happen in our life that triggers this pain. And if we don't know how to respond to those things differently, it's going to continue to negatively impact us. So, just an overview. I'm on day 8, not today, but I'm talking about day 8 of getting to this point where I have a meltdown. I'm unable to self-regulate and realize if I didn't have the mentally strong method, this would be the point where I would feel broken. So if you are on a grief journey, I challenge you in many ways not to give up, to find your 5 selves. We talk about self-care, self-regulation, self-improvement, your spiritual self, self-movement. And when I talk about self-regulation, the mentally strong method is one way, but seeking professional help is another way to learn to self-regulate. We have to, or it is in our best interest to take control of this grief process. I'm trying to practice what I preach. I believe that I can do it. I believe that you can do it. I believe that you are mentally strong.